Okay, hello dear students, Assalamu alaikum. So our today's lecture is on biochemistry, vitamin B7, B9 and B12. Okay, so let's begin our class. So previous on Thursday we studied regarding vitamin B6. Okay, and we ended our lecture on B6. Okay, I hope you all understood that. So our today's topic, we will be starting from vitamin B7, which is also called as biotin. Okay, so you have to remember the names of the vitamins with their initials B7 and biotin. You have to remember this. Okay, now there is not much that is asked in MCQs for biotin. Okay, there are very few things that you need to remember for the purpose of MCQs, that is vitamin B7 and biotin. Okay, then it is a cofactor for carboxylation enzymes. You have to remember the word carboxylation. Okay, now there are what are carboxylation enzymes? What do you mean by word carboxylation? Carboxylation means that adding one you are adding one carbon atom. Okay, you're adding one carbon atom, or I can say you're adding either you're adding a methyl group or you're adding a carbon dioxide, whatever it is in the compound form, you are adding one carbon. Okay, so now you see over here we have these three enzymes that have the word carboxylase in them: pyruvate carboxylase, acetyl-CoA carboxylase, and propionyl-CoA carboxylase. All of these three enzymes are the enzymes of TCA cycle. Okay, all of these enzymes are the enzymes of TCA cycle. So you have to remember the you have to remember you don't have to remember which enzymes are these. Okay, only when I was teaching you vitamin A, I told you to remember the enzymes name for vitamin BA because they have been asked previously. But for vitamin B7, you don't need to remember the three enzyme names, because all of the three names are starting from carboxylase, and you have not studied any vitamin that is a cofactor for carboxylation enzymes. You have not studied this thing previously. Okay, when we were studying vitamin B1, we were studying that B1 is a cofactor for dehydrogenases. Okay, then in B2 and B3 we studied that it is used in redox reactions. When we were studying B5, we studied that it's a component of coenzyme A. Okay, and when we were studying vitamin B6, we studied that it's used as a cofactor in transamination. Okay, in transamination, decarboxylation, and glycogen phosphorylase. So we studied decarboxylation. We have not studied carboxylation yet. This is very important. So you should know B7 is used as a cofactor for carboxylation enzymes. This statement is important. Okay, people, this statement is important. Remember this. You don't need to remember the enzyme names. You don't need to remember this whole story, but just know all of these three enzymes, pyruvate carboxylase, acetyl-CoA carboxylase, and propionyl-CoA carboxylase, are used in TCA cycle. Okay, and what carboxylation means? Adding up one carbon. You see, pyruvate has 3 carbons, but oxaloacetate has 4. So you add up one carbon. Similarly, acetyl-CoA is 2 carbon, but malonyl-CoA is 3 carbons. So you add up one carbon. Then propionyl-CoA is 3 carbons, but methyl-malonyl-CoA is 4 carbons. So you add up again one carbon. The carboxylation mechanism is like adding one carbon. Okay, I think I'm clear now. Let's move to the deficiency. We'll not waste much time on B7. We get only 2 or 3 important MCQs in B7. One thing you need to remember, its name biotin. Another name you need to remember, it's a cofactor for carboxylation enzymes. Okay, then in deficiency, this is very important, raw egg whites. They do ask an MCQ on vitamin B7 that a patient is the patient is the patient is eating excessive raw egg white, or we can say the patient is hyperlipidemic. Okay, hyperlipidemic. The patient who have dyslipidemia, or the patients who are hyperlipidemic, those patients are prescribed not to take egg yolk. Okay, they are prescribed not to take egg yolk because egg yolk is full of cholesterol. So we say to them, take raw egg whites more. Okay, so they every day kind of eat 2 raw egg whites. So when you have an excessive ingestion of raw egg whites, okay, you have this deficiency of vitamin B7 because egg white does not contain vitamin B7. Egg white do not contains vitamin B7. So you should know this. This is asked in MCQs previously. So this is an important point you need to remember. But then again, let's read the whole thing for you. We have studied when the general deficiencies we see in vitamin B complex deficiencies are 3Ds. Okay, dermatitis, dementia, and diarrhea. Okay, so you see dermatitis here. But then if you have enteritis, that is inflammation of your gut lining, you will see diarrhea too. So you got this dermatitis and diarrhea. Okay, and then they have not written dementia here, but they have written alopecia, like baldness. So you will see baldness. You also studied alopecia in vitamin B3 and B2 too. Okay, B3 actually. So you have to remember, but these things are not being asked a lot. Okay, also there are no names of antibiotics given, so they will not ask an MCQ on this or an MCQ on this, but they will ask an MCQ on this because this is a specific point, raw egg whites. So this point, raw egg whites, is again important. So you need to remember only 3 points from vitamin B7 from this first aid book. Vitamin B7 is called biotin. Okay, it is a cofactor for carboxylation enzymes, which are the enzymes of TCA cycle. Okay, and the excessive intake or ingestion of raw egg white, not cooked egg white, raw egg white means not cooked. Okay, causes the deficiency of vitamin B7. You have to remember these particular things. Okay, so let's move to vitamin B9 now. I'll not waste more time on B7. It's not too much important. B9 and B12 are way too important. So now we are studying vitamin B9. Very, very important. Lots of MCQs have been asked from B9 and also B12. Okay, the name is folate, or you can say folic acid. Okay, the folic acid we give to the pregnant women, or the folic acid we do give when the patients have bumps on their tongue, which we call chale. Okay, we give folic acid to treat these things. So basically, what is folic acid? Folic acid is vitamin B9. It is vitamin B9. Okay, you should know. So there are two names, folate and folic acid. Okay, now what are the functions of B9? It is converted to tetrahydrofolic acid, THF, a coenzyme for one carbon transfer methylation reactions. So the important terminology here are two. Okay, you need to remember two things. If you are a NEB student, you need to remember one thing, methylation. If you are a student of USMLE, PLAB, HOD, SLEAMC, you need to remember THF too. Okay, you have to remember these important words. That B9 is converted to tetrahydrofolic acid, okay, and it is a coenzyme for methylation reactions. What is a methylation reaction? In which you add a CH3. In which you add a CH3. This is called methylation. This is a methane, okay, methane group. So you need to remember the word methylation with B9 as you remember the word carboxylation with B7. Okay, then it is found in leafy green vegetables, absorbed in jejunum. Important, very important. Okay, write down 3 points I'm just telling you right now and mug it. Very important MCQs for biochemistry. Okay, first point is iron. Iron. With the word iron, remember duodenum. With the word iron, we need to remember duodenum. Okay. With the word B9, that is folic acid or folate, we need to remember jejunum. Okay. Remember the word jejunum here. And with the vitamin B12, with the word B12, remember ilium. So these are very important points and very important MCQs. Okay, now let me explain you. Iron is absorbed in duodenum. Okay, vitamin B9 or folic acid, we say, is absorbed in jejunum, and vitamin B12 is absorbed in ileum. So these are the 3 locations of small intestine where all of these 3 are absorbed, and students forget this. And these MCQs are easy MCQs. Okay, they're not twisted, they're straightforward. So you have to remember the straightforward MCQs, okay? So remember this point in vitamin B9 that it is absorbed in jejunum. Okay, vitamin B9 is absorbed in jejunum, iron is absorbed in duodenum, and B12 is absorbed in ileum. Okay, remember these 3 things. They can ask you in a patient who has this jejunostomy, okay, and his duodenum and ileum are joined together and jejunum is resected and thrown. So in that patient who do not have a jejunum, vitamin B9 will not absorb. Similarly, in a patient whose stomach is directly joined to jejunum and there is no duodenum, iron will not absorb. And same goes if the patient's jejunum is directly connected to the ascending colon and no ileum is there, vitamin B12 will not absorb. So there are in surgical units, there are such cases in which patients undergo certain cancers of a particular part of small intestine, and then we have to cut and remove that part of small intestine so that it may not spread to the other parts. And then we have to join that those 2 open sections of small intestine together. So in those cases, we have to be really careful that the patient will now it's the duty of a surgeon who is doing that work to remember that he has, like, let's say for example he has removed jejunum, so he should prescribe vitamin B9 to the patient as well. If the patient will take these leafy green vegetables, if the patient will take these leafy green vegetables, the patient will not be getting vitamin B9 from it. The reason is because there is no jejunum in the body. So you have to remember the absorption is in jejunum. So these things are basically clinical. These are not like important points just for MCQs, but these will help you in your clinical setup always in life. So remember these 3 points, very important. Now let's move further. So up till here, what I told you is you have to remember that vitamin B9 is converted to tetrahydrofolic acid, and it's used in methylation reactions. So you have to remember the word methylation for your exams, okay, because every vitamin is used in different reactions. Like B1 is used in dehydrogenase reactions, okay. B2 and B3 are used in redox reactions. B5 is used in not B5, we don't have B5, B6. Vitamin B6 is used in transamination and decarboxylation reactions, okay. Then B7 is used in carboxylation reactions. Similarly, B9 is used in methylation reactions. So you have to remember in which reactions that enzyme is being used. This is asked in MCQs, okay? And methylation means adding up a methane group, which is CH3, okay? And then you have to remember in which portion it is absorbed. All three of them. For all three of them, they're different and you have to remember. Then this point is your MCQ again. There are a lots of MCQs from B9 and B12. Just mark it in your book. Lots of MCQs. So in B9, you have this MCQ that it is important for the synthesis of nitrogenous bases in DNA and RNA. If you remember from the biochemistry portion, nucleic acids or nucleic acids, yes, there was a chapter in Lippincott which we studied nucleic acids. We studied these structures of purines and pyrimidines, okay, in the structure of DNA and RNA. And we have these 5 nitrogenous bases, okay, termed as guanine, cytosine, thymine, and uracil, okay, and arginine. So we have these 5, okay, guanine, cytosine, thymine, arginine, and uracil. But in RNA we have this U, okay, we have this U, but in DNA we do not have this U, okay. So the important MCQ here, so this is like I'm kind of giving you an overview that what is a nitrogenous base, okay, but the important MCQ for your exam in biochemistry is B9 is used in the synthesis of DNA and RNA, but B12 is only used in the synthesis of DNA. So you have to remember the difference. B12 only DNA, okay. B12 is used in only the synthesis of DNA, but B9 is used for DNA and RNA both. So you have to remember this point for MCQs. It is very important MCQ, okay? Just mark it and remember B12 only DNA and B9 DNA and RNA. Just remember like this, okay? So another important thing is when a patient undergoes the deficiency of vitamin B9 and B12 both, you will not see the deficiency so quickly. Why? Because they have a reserve pool in liver, okay. All these reactions, methylation, okay, or the TCA cycle, or the glycolysis, or the gluconeogenesis, or the glycogenolysis, all these cycles are going inside your liver, okay. Your fatty acid synthesis is going inside your liver. So all of these things are going inside your liver. So definitely where will be the reserve pool? Because they are used in the reactions also, okay. So the reserve pool will be in the liver. So it is very easy to remember. It's like no rocket science or no concept behind it. It's very simple that all the reactions are going in the liver, all the metabolic reactions. So the reserve pool of these vitamins will obviously in the liver, and the patient will not undergo acute deficiency of them, okay. So you have to remember the word liver with this. So now up till functions, I've taught you some really important MCQ points. Okay, one thing is, it is converted to THF, tetrahydrofolic acid. Another, it's used in methylation reactions. Then it's absorbed in jejunum, and it helps in the synthesis these nitrogenous bases, these bases which are used in the formation of a DNA and RNA structure. Okay, but if we talk about B12, vitamin B12 is used in the synthesis of nitrogenous bases that are only used in DNA. It means we are not talking about uracil. Uracil is an RNA nitrogenous base. So in the case of DNA, you only have GCTA, you do not have U. Okay, and also vitamin B12 is absorbed in ileum. So the differentiating points. Okay, also like it's used in methylation, so we have also another reaction in which B12 is used, but the next topic will be B12, so we will be covering that over there. For here you have to remember up till this point. Okay, so the next thing is the next thing which we will be studying is deficiency. Okay, very important points again over here. Very important points are again over here. Macrocytic megaloblastic anemia. Two different terminologies. We have a microcytic anemia. We have anemias of three types, okay? Microcytic, normocytic, and macrocytic. Okay, now the word represents what does they mean. Micro means small, normal means normal, and macro means big. So the size of RBCs, if they're small, it is microcytic. Okay, if the size of RBCs is normal, it is normal, and if the size is big, it is macro. Now anemia is basically the deficiency of hemoglobin. Okay, it is the deficiency of hemoglobin in our blood, and definitely heme and globin, both of them are a component of red blood cell. So you will have in the complete blood picture, you will see that the patient has a red cell distribution count. There is, you will always see this RCD count written in your CBC, complete blood picture. That will also be decreased, and the hemoglobin will show you that the patient is anemic. Okay, so normally we take 10 as normal in males, and 11 as normal in females. Okay, females have a little higher value of HB as compared to males, and so if we go at 8 or 9, we take it as anemia. Okay, but the best range is 12, 13, 14. Okay, this is the best numbers for HP. Okay, so you should know that what is the difference between normal, micro, and macro. And then we have this megaloblastic anemia. Okay, the word megaloblast means the RBC structure is enlarged. Okay, it is enlarged, and it's like it shows the representation of blastic cells. I may show you it in a diagram better than drawing, so that you may. I don't want to rub my things, so I will kind of. So you see these cells, they are enlarged, but they are this is a bone this is the RBCs in the bone marrow, and they are quite big enough not than normal. So some of them are normal, like this is normal, like this is normal, but these are enlarged. So you see, this is megaloblastic. Now you see, this is normal, and this is megalo. So it's big, it's huge enough. So these are the differences. And then we have this very nice picture, a normal blood cell and a megaloblast. So this is normal and this is like very enlarged. Okay, so let's go back. So now you see we have this you see this megaloblastic anemia in B9 deficiency and also in B12 deficiency. So I'm writing plus B12 so that you may know we are talking about both B9 and B12. There is a very important MCQ now because we are on this topic of anemia. There is a very important MCQ which is asked in your exams about anemia in biochemistry section, and that is the most common cause of nutritional anemia is what? Okay, so you should know the most common cause. Like they are asking you the cause, like which deficiency of nutritional. So the most common cause of nutritional anemia is iron deficiency anemia. Okay, so you have to remember that iron deficiency anemia is the most common cause of nutritional anemia. This is an MCQ. Okay, and then you have to remember this megaloblastic anemia with B12 and B9 both. Okay, so let's go further. Then hypersegmented polymorphonuclear cells, okay, like they are basically just as the structure of neutrophils. Okay, let me show you. Just as the structure of neutrophils we have, if you know how neutrophils look like. Hmm. Okay, so I kind of want to share only this picture. I think you can see the screen. Okay, can you type in text, please, if you can see the screen of this right now, the full screen. So these are the polymorphonuclear cells, okay, which we call granulocytes. They include the eosinophils, the neutrophils, the basophils. Okay, so these three are the polymorphonuclear cells, and we in certain conditions we see, like in bacterial infections we have increased neutrophils, in eosinophils, in the parasitic infections or in allergies. Okay, similarly basophils when we have these respiratory diseases more. Okay, so in certain like viral, not all of them, so basophil count is like increased more in your respiratory problems. So you see all these things are increased in certain cases. Now when the cell is become enlarged, okay, when the cell becomes enlarged, just as in here, just as in here, okay, it becomes hyper segmented. Okay, that condition is what we call polymorphonuclear like hyper segmented cells. Okay, so let's go back to the portion of, okay, so now you're okay with this macrocytic and then megaloblastic anemia. Okay, now we have this hypersegmented polymorphonuclear cells that I told you, and then glossitis. So when we have a deficiency of not only B9 but also B3, okay, you will and also B2, you will see glossitis. So basically glossitis is a good feature of vitamin B2 deficiency. You see chalosis like at the corners of the mouth, there is ulceration, or you also call it angular stomatitis. Okay, so and glossitis, that is a thick and enlarged tongue, or you can say red beefy tongue. In the case of glossitis, it is used, red beefy tongue terminology is also used, so remember both of them. But you also see this in B9 too. The most important point is this: no neurological symptoms as opposed to B12 deficiencies. In B12 deficiencies, the patient will have, you will get an MCQ, the patient will have megaloblastic anemia plus neurological symptoms. Okay, but in B9, megaloblastic anemia and no, there will be no neurologic symptoms, or they will not even write this word neurologic over there. So that is the point from where you have to grab that, they are talking about only B9. So remember, these points are very important. Okay, then we will move to deficiencies later. First, see this labs. This is in here. One thing is really important, and that is increased homocysteine. Okay, this is for both B12 and B9. So there are lots of similarities too in B12 and B9, but the MCQs are mostly asked where there is differences. But you should know, there have been many MCQs asked on homocysteine, increase homocysteine. So like these levels are increased in urine. Okay, we have this homocysteine urea. Okay, so when what happens is that the renal tubules, they do not absorb the cysteine. When they do not absorb the cysteine, because cysteine has been, like, homocysteine has been converted to it. So we will see this mechanism. Let me show you it here. You see this? You see this picture? In this picture, this homocysteine is converted to cysteine, and the the vitamin responsible is B6. Okay, so here at this level, homocysteine is being converted to cysteine, but you also see this increased homocysteine in the case of B9, because this tetrahydrofolate, okay, this conversion is not only of because of B12, but also because of B9. So like add it in your book, that B9 is also converted to THF, as we read previously. Okay, so if this mechanism will not happen, if this will not be there, if this methylation reaction will not occur, okay, you will not be able to convert it into tetrahydrofolate. Okay, and these are responsible for this enzyme also. So if this enzyme will be lacking, you will not be able to convert this homocysteine into methionine. Okay, so in the patients, so this whole cycle is interconnected, and we have 2 to 3 MCQs from this cycle. Okay, so one thing you need to remember, that the increased levels of homocysteine are seen in B6, are seen in B9, are seen in B12 deficiencies. So just write it in your book that increased homocysteine levels are seen at these 3 particular levels. Okay, and this homocysteine is converted to cysteine. Okay, so when you have a deficiency of B6 particularly, okay, you will see cysteinemia as well. Okay, cysteinemia in blood also as well. Then, sorry, cysteinuria and homocysteinemia. So these are 2 different terminologies. Again, I'll explain you. If you have a deficiency of vitamin B6, okay, no B6, you will have increased cysteine levels in in your blood. Okay, in your blood, because you don't have this, so this is not converting. Okay, and you will also have increased levels of this in your blood. But when you have this vitamin B6 and you do not have B9 and B12, you will see increased homocysteine levels in your blood, and you will have this this increase. You have B6, okay? So the homocysteine will be increased in your blood, but B6 is there. So some of the B6 will be converting homocysteine into cysteine. So you will see increased cystinuria as well, okay? So just remember these two things. Then there is another MCQ, but that is like quite related with this picture and vitamin B12, but I like want to tell you it's been asked previously in your 2018 examination. And that is that this they have asked it like very straightforwardly, that the cysteine, it can be synthesized from two amino acids. There are two amino acids that are synthesizing this cysteine, and one of them is methionine, okay, and the other one of them is not written over here, just write it down, it is serine. Write it down. This was an MCQ, and serine was your answer. Serine was your answer. So this is an MCQ which came from this picture, okay? So biochemistry MCQs are very tacky. You should have a good grasp on first aid for it. So the cysteine can be synthesized from two amino acids. One is methionine and one is serine, okay? So you have to remember this MCQ, which has been asked lately, okay? And then let's go back to the, I think you're clear with this, okay? So there are MCQs from this picture also. So let's go back to vitamin B9. Okay, now you see, where were we? Yes, labs. Increase homocysteine levels, normal methyl malonic acid levels. Why the methyl malonic levels will be normal? Because none of the vitamin is used in its in its like synthesis, okay? B9 is not used. You will see a problem in methyl malonyl levels only in B12. So this is a difference, and this is your MCQ again. Wherever you will see a difference in B9 and B12, that will be your MCQ for sure, okay? So let me show you how. Again, that this picture, you see this methyl malonyl CoA, okay? This comes from your fatty acid synthesis, okay? From your fatty acid synthesis. Now this product, methyl malonyl CoA, is using vitamin B12 as a cofactor, okay, to work for this enzyme. This is the main enzyme, and this is a B12 is as working as a coenzyme for this, okay, and they're forming the succinyl CoA, okay. So if you do not have B12, you have a deficiency of B12, what will happen? The levels of methyl malonyl CoA will rise. So you will see increase methyl malonyl CoA levels, okay. But in the case of vitamin B9 deficiency, these levels will be normal, because we have nothing to do with B9 in that mechanism. So this is a differentiating point, and this is your MCQ. So increase homocysteine and normal methyl malonyl acid levels, okay people. Then another important MCQ, every line of first aid is important. Every line of first aid is very important. So in B9, you see, it is seen in alcoholism in pregnancy, okay. So the MCQ they ask regarding pregnancy is that which vitamin causes infertility? Which vitamin is responsible for infertility? Or which vitamin is involved for neural tube defects? I will write the short form NTND. Okay, neural tube defects. Which vitamin is responsible for infertility? In a mother, okay, in a mother, not in a father, in a mother, and neural tube defects. So that is vitamin B9. So if the mother is not taking vitamin B9 throughout her pregnancy course that is 9 months. The day she got to know that she is pregnant, since that day she have to start taking folic acid, which is vitamin B9. Okay, the folic acid is basically vitamin B9. So, and she have to take it every day till 9 months. It is important. It will help not causing neural tube defects. Although the first trimester is the most important one, but again, you have to remember at 9 months. Okay, so remember this point. Then comes to this section, deficiency can be caused by several drugs, very important. Phenytoin is an anti-epileptic drug. Okay, phenytoin is an anti-epileptic drug. It has some serious side effects if they are taken by females. So nowadays we don't use phenytoin much, we use phosphenotoin. Okay, we use phosphenotoin these days, but not phenytoin much. If prescribed, we don't prescribe phenytoin too much these days. So this is an anti-epileptic drug. So if the patient has epilepsy, you have to ask that patient which drug he's taking. Okay, so very important. So now let's say, for example, you're sitting in a clinic and you got a patient with this anemia, and you order a CBC, and you see in the results, in the morphology written down there, it was written macrocytic megaloblastic anemia. Okay, and you have checked his homocysteine levels, her homocysteine levels, and you got increased homocysteine also. And so your mind should go to vitamin B9 deficiency. Okay, and then you have to ask certain questions in your history taking, and there you have to ask regarding if she or he has epilepsy, if she or he is taking sulfonamides, if he or she is taking an anti-cancer drug, which is methotrexate. Okay, so these drugs can cause a deficiency of this vitamin, resulting in this anemia, because a patient will come to you when he or she will feel anemic, otherwise they will not come. Okay, so these things are are important, and you should remember them. So remember phenytoin. Also, you will see some side effects of phenytoin, like the patient will have facial hairs. Okay, this is a very important side effect of phenytoin, facial hairs. So females taking phenytoin do grow facial hairs, and also there's an effect on their teeth. So you have to like kind of remember. We will study in detail about the phenytoin and pharmacology. Okay, and sulfonamides. So sulfonamide is an antibiotic. Okay, it's an antibiotic. We have three drugs which we call, in hospital setup you will normally listen sulfa drugs. You will see the word sulfa. Okay, so the thing which we call sulfa drugs is there are three. Okay, one of them is sulfonyl urea. You can write it down, it's very hard to write on a keyboard. Sulfonyl urea. Okay, you can write sulfonyl urea, which is used in diabetes mellitus. So this is like the differentiation. Okay, and then you have one drug which is called sulfasalazine. Okay, this is basically what we call sulfa drug. Sulfasalazine is in short in hospital setup called sulfa drug. Okay, so sulfasalazines, these drugs are used in autoimmune diseases, for example Crohn's disease, which is an inflammatory bowel disease. Okay, so we use these sulfa drugs in them. And then we have the sulfonamide, which is an antibiotic. Okay, we will study this drug under the microbiopharmacology. Okay, so remember these things. And then methotrexate is your anti-cancer drug. A very important point regarding your methotrexate, which you need to remember, is just write it down in your book that it inhibits the pyrimidine synthesis. Okay, is asked in your MCQs, and this is an MCQ from your, I guess it's first page when your biochemistry first, it's like second or third page, in which you will see in your first aid there is a pyrimidine and purine synthesis pathway. Okay, I will teach you that too. That's pathway is very important, and all those drugs that inhibit the pyrimidine and purine synthesis are very important. One of them is methotrexate, and there are other drugs like trimethoprim or leflunomide, 5-fluorouracil. All these drugs inhibit pyrimidine synthesis, but one of them is methotrexate. So there is a particular step at which this drug inhibits. But right now, because the name is here, I'm just telling you, remember this drug with that. Okay, and we will study molecular biochemistry too. Now, supplemental maternal folic acid at least 1 month prior to conception, and prior to conception, see, like before pregnancy and during early pregnancy. First semester is very important, but you have to take it for the whole 9-month period to decrease risk of neural tube defects. Okay, give vitamin B9 for the 9 months of pregnancy. So here we have finished our vitamin B9, and I have told you all important MCQs regarding it. So if you don't mind, people, we have 4 minutes 55 seconds left to this automatic distortion of Zoom meeting. So if you don't mind, I may end this meeting now and I will begin another meeting. Okay, and you have to click the same link which is being posted in WhatsApp group, so that we can cover vitamin B12 today. Okay, we just had a lecture of 45 minutes and our 15 to 20 minutes are remaining, so we will cover vitamin B12 also today. So I'm ending this meeting so that we may listen that whole lecture together. So you can join me back again. Okay, and I will wait for you. Join me back again for B12. Okay, I'm ending this because it will disconnect after 4 minutes.